Hi, I'm Dr. Ben from Mornington Peninsula Chiropractic Centre, and today I wanted to talk to you very briefly about a thing called a facet joint. So you see, your spine is made up of two key joints. One joint is what we call the disc joint, and we often hear a lot about discs when we talk about spines, but one of the very important joints, in fact they account for about 20% of the stability and strength of your spine, are what we call facet joints. These little special gliding joints at the back of the spine, and they're called facet joints because they're like small faces, these flat surfaces that help your spine glide into the right sort of direction and position. They help prevent over torsioning and over twisting of your spine, over flexing and extending, and they help keep your spine in proper alignment. Now these facet joints are quite special in that they've got a fine cartilaginous surface, and the joint is then surrounded by a capsule, and the capsule holds a special fluid which we call synovial fluid, and it's a very slippery, lubricating kind of liquid that's within the joint, and that helps keep the joint mobile. Now sometimes we can injure our joint, and when we injure the joint, sometimes we damage the cartilage surface on the joint, and as soon as that happens we start getting wear on the joint itself. So we can start getting little tears and wear and tear, and it can lead to what sometimes we've called in the past osteoarthritis, or what we these days call degenerative joint disease. And so as a chiropractor, one of the things we do is we make sure the joint is kept moving properly, that it's kept gliding the way it's supposed to minimize the chance of joint damage and that arthritic change within the joint. It's very important that when we examine the spine to find out which joints are not moving properly. So when you see a chiropractor, make sure that a proper examination is performed to check to see that the little facet joints are gliding properly, and if they're not, that the right treatment is applied to restore normal function to those facets. For two reasons. First of all, to stop the arthritic change, like we talked about, but secondly, to make sure that there's normal nerve function. Because when the facet joints stop working properly, we start getting nerve irritation. And of course, as you know, that may cause pain, whether it be localized pain or even referred pain referred to a different part of the body. So look after those facet joints, keep them moving, and until one day we maybe catch up, remember, look after your spine.